Dr. Abdul Hafiz. I'm a family physician based in Manchester. I'm also CEO of Association of Pakistani Physicians and Surgeons of UK. I also welcome Dr. Vakas. Dr. Sohail Chutai is part of us, so he's already welcomed him. Obviously, both of them are very inspiring personalities, and obviously we follow the work they are doing. This is mind-blowing, this is future. Obviously, we had a webinar quite recently about artificial intelligence and post-COVID era, the way, the direction we are following, the new digital world. And obviously, there's an absolute need in terms of delivering healthcare worldwide, health for all, which WHO has failed over a long period of time. But using this technology, the shortages of the staff worldwide, I think this will go a long way in the future of medicine. Thank you.
So allow me to share my screen first, and can you confirm if you can see my screen?
Definitely, yes.
Yeah, what you see on the screen is actually a day back in January 2020 when I actually went my foot down and pressed the accelerator, managed to speak to the health minister saying, look, this is where we are. We should go ahead now. We should revolutionize distance remote teleconsultations because there was no COVID that time. The COVID was hardly known. It was only in Wuhan, or maybe just people are talking about it very, very remotely. But I said to the health minister, we have to commence some kind of remote teleconsultations because people cannot reach the doctor in basic health units. My idea was taken well, but logistic problems were posed, and it was kind of semi-shelved. Okay, we like this idea and we'll think about it as you come next time. And you know what that means. Okay, so I went back. In March, I was there in Pakistan again at the Pakistan Society of Internal Medicine conference, and that was 12th of March. Now, by that time, China had got 1,000 deaths with COVID. So Pakistan had about more than 300 cases registered in Lahore only a day before. 12th of March was the birthday of my little daughter, and I was presenting this conference, this press conference in medical seminar, and I said, I propose Pakistan to have a telemedicine helpline because very soon we're going to shut down the country because we can see other places that's happening. Now that I was flying the same day back to London because I feared that country will be locked down. And I got a call from a very senior person from the government when I was airport, can you come and set this up, this telemedicine? We are going into lockdown. I said, I'm just flying now. As soon as I reach London, I'll have my team deployed and we'll set it up. And then on the 8th, then all the stakeholders met. All the medical university chancellors in Punjab, they were called by the governor and they said, I've given 2 days to Dr. Chuktai to set up telemedicine. Let's give the hand, all the support, logistic support, because we need chain of telemedicine hubs and we need doctors. So there was a special scholarship or special initiative announced for the young doctors to come and join telemedicine. All the vice chancellors took the stakes. They took the ownership of the project. The governor supervised it, and the vice chancellor of University of Health Sciences hosted the first call center or telemedicine call center. This was the announcement by the health secretary and by the vice chancellor. And this was inaugurated on 18th of March in Pakistan. In the space of 3 to 4 days, we had the highest level of the Punjab machinery join me. We were given all the logistics to set up a telemedicine center. More than 500 doctors. This is an inaugural ceremony. And then we started training doctors. So I had set up a training link from UK to Pakistan and trained more than 500 doctors in the next 7 to 8 days. All the transport logistics were given to us. Even the helicopter was offered to us. That we can't go by road because of blocks. The country was in a lockdown on the 18th. The lockdown started on the night of 12th of March, the same day the press conference was. And then the 18th of March, the roads were deserted. So we were provided all the logistics to go through all the barriers, set up telemedicine hubs. And then we also had started training in small groups. I was training from UK that time. This is me on the left-hand side here at the bottom of the screen, training from UK at the University Health Sciences Auditorium with some kind of social distancing being observed. And then this was a roller coaster. The training program went on, and then we started training medical universities after university, and about 17 medical institutions in the space of 2 weeks were set up. Now, this is actually before that. Before we were so ready at that time. I'm glad that we had done a telemedicine course in April 2019, the year before. I was training the doctors, and we had around 560 doctors trained a year before COVID started. So that training helped because all the doctors who were trained, they came up as well, and we had a head start. So we went to university after university. The governor, the vice chancellors, they traveled with us. And that's me training at PIMS. And then it's in Rawalpindi. And then Multan, you know this gentleman, Professor Mustafa Kamal Pasha, he actually lost his life.
मैं निश्तर के कॉल सेंटर में यहाँ पर आया हूँ और यहाँ देखें सारे हमारे डॉक्टर साहिबान बैठे हुए हैं, अपनी ड्यूटी अंजाम दे रहे हैं और माशाल्लाह सुबह से 20 कॉल यहाँ रिसीव हुई हैं और इस तरफ हमारे स्पेशलिस्ट बैठे हुए हैं और माशाल्लाह सारा रंगदही से काम कर रहे हैं। मैं इस वक्त तकरीबन 9:30.
So I want to pay tribute to Professor Mustafa Kamal Pasha. He lost his life, Vice Chancellor, very dynamic. He lost his life due to Corona. And it's one of the big calamities we had in Pakistan. So this is Jinnah Medical College, Lahore. And then we did independent trainings and testing of the website. I set up Doctors 24/7 online, one of my telemedicine projects. I adapted to Hotline, and then I had it tested by independent observers from USA, my colleagues. So this is Ned Thurman, and this is Bud Zorowski. They're very able telemedicine stalwarts in USA, my colleagues there. They tested the whole system. And then from South Africa, African countries, they tested again our system to see whether this is applicable for their countries as well or not. And then we had independent testers from other places. And that all went so well that we had such a huge dynamic chain of doctors. Everybody was so motivated. The ladies, the girls, they could stay at night in the university campuses. The food was being sent to them by people. There was such a big phenomenon in Pakistan. And then South African guys are testing this now. So this is now the actual process going on. That's how it happened. This is Voice of America.
अहमद को गले की तकलीफ है। वो टेलीमेडिसिन में राब्ता करके डॉक्टरों से मुफ्त रहनुमाई ले रहे हैं। जो बुखार है और खांसी होती थी, तो मुझे लग रहा था कि मुझे कोई इन्फेक्शन तो नहीं हो गया, तो उसको कंफर्म करने के लिए कॉल किया। टेलीमेडिसिन सेंटर में काम करने वाली डॉक्टर फरवा रुबाब कहती है कि मरीज का दर्जा हरारत और ब्लड प्रेशर चेक करना आसान नहीं।
पेशेंट की हमें थोड़ी सी हेल्प चाहिए होती है। एक तो पेशेंट के पास, हर मरीज के पास, हर इंसान के पास घर में एक थर्मोमीटर मौजूद है। वो जब भी आपको कॉल करता है और मरीज, आप चाहे देहात से कॉल कर रहे हैं या सिटी से कॉल कर रहे हैं, एवरीवन इज विजिलेंट इनफ। वो जब कॉल करते हैं तो बताते हैं जी डॉक्टर साहब मुझे 100 बुखार था, 101 बुखार था। कैसे जी पता? मैंने चेक किया था। ठीक है, ये ब्लड प्रेशर का ज़ाहिर है यूजुअली।
So this is now this project was being echoed now in many countries. UK picked it up. BBC reported that why is NHS not doing this? By this time we had around 25,000 deaths in UK, and Pakistan had luckily 4 or less than 4,000 deaths, whereas in India they had already crossed 50,000 deaths by that time. So the BBC did a program that why UK is not following a hotline of telemedicine, and that's what this small report is. Again about Pakistan.
We'll suggest that you continue. From his home just outside London, this doctor's helping treat a patient in Lahore. Holding. A tablet, a doctor there shows him the intensive care ward for coronavirus patients.
This is Jinnah Hospital.
Link. Hospitals in the country have been stretched. Through this software, they can share case notes. Dr. Akhtar helped lead the COVID-19 response in this part of Britain. Now he wants his experiences to help his country of birth.
This is where the APPS UK stepped in. and provided doctors to do grand rounds of ICU by UK APPS doctors, along with the help of Pakistani ICU consultants, using this software.
We're very proud of the NHS service we're giving here, and because of our relationships, both in medicine and otherwise in Pakistan, it was very important for us to help our colleagues and to help the people of Pakistan.
The healthcare system in Pakistan has always been under-resourced, and whilst in some cities the number of new cases now appears to be decreasing, coronavirus has highlighted its weaknesses. To ease the pressure, this London-based doctor created a series of telemedicine portals. Through this one, doctors here can hold consultations with coronavirus patients in Pakistan.
We haven't got resources there to really plug the gaps of service. So any skill, any special skill from UK will be warmly welcome in Pakistan, where doctor and patient can speak the same language. We can create a bridge, no matter where they are, through telemedicine.
So far, recorded deaths in Pakistan have been far lower.
So in this software, we provided, this is UK-based doctor, this is Pakistani-based ICU consultant, this is a patient, and you can see that
in the UK,
the ECG is directly connected from the monitor on the iPad, whereas the UK doctor is giving instant instructions, cut down oxygen, increase the steroid, and they're discussing the case by case as they went along.
Taking part in this scheme hope they can do their part to save.
So now this was again echoed by BBC UK. They actually took the software 24/7 online, and they presented that as a feature report in one of their programs. Professor Angus Wallace, he was the pioneer of Royal College of Surgeons of Edinburgh for clinical bioinformatics. He presented this case and pleaded NHS, let's start doing telemedicine helpline. This is that project, and I gave a briefing to the president, Dr. Arif Alvi, when he heard about it and he wanted a briefing on this. He came to University of Health Sciences. I briefed him on this project and shared all the results. At that time, we had these results. On the 16th of May, it's almost 2 months down the line, we had around 10,000 patients seen, 16,000 patients seen in fact. And then on the 25th of September, Vice Chancellor Professor Dr. Javed Akram presented results to the governor, and 500,000, 500,000 people had already benefited from this telemedicine helpline. So the government responded, and they kind of said thanks, and they awarded few recognitions to me. This is some of them. This is UK High Commission, and this is Foreign Ministry. This giving us an award on this base, and a few other things. Governor also awarded some recognition, and I think that's where we stand now. Pakistan has been sensitized to telemedicine. Now the telemedicine culture is brought in. The consumer wants it now. It's not that we are pushing a product. Now the consumer said, I want to have a system where I can be safe, and doctor wants it as well, because doctors felt unsafe seeing patients. So then the government put some restrictions. Now the legislation comes into the being. That's where we stand now, because now if you want to practice telemedicine in Pakistan, the most desirable and the fail-safe is that you have to have these regulations met. My software actually is built based on these regulations, because we are one of those people who suggested recommendations to the government of Pakistan what telemedicine software should be like and should be safe enough. And then we had affiliation with many universities in Pakistan. And I think I propose that the telemedicine software is not video conferencing. Video conferencing is not telemedicine. Video conferencing is a small part of telemedicine. These are the attributes I suggested. There were 27 elements of a software we should have to call a complete clinical system. There's no time for detail. And then we started training doctors. This is a telemedicine certificate we started back in May, 8 lectures course I delivered from UK. And I engaged my colleagues from UK as well in that. Now we are into the bigger deal. We are doing a master's degree in telemedicine in Pakistan, and we are starting the first module with telehealth, hopefully by December or January, with the help of University of Health Sciences. Telemedicine is now in country, not only as a product, not only as a service, as a specialty in a teaching hospital. Now, these are the field tests of my software. done in remote areas in Pakistan. This is what we're doing in Pakistan right now. We are connecting basic health unit of Pakistan and putting a specialist there through telemedicine using this software. And these are the field tests. We're only picking up 536 kilobyte of bandwidth, and we are able to do this on a 3G phone connection. As you can see, they're all field tests, happy people. So there is a lot more happening. I mean, I can share time to time all these things, but I want to hear from my colleague, and I've taken a little more time, so I want to give it back to Irfan. Thank you very much for very patient listening.
Thank you very much, Dr. Chugtai. What a brilliant piece of work you have done, and salute to your efforts, and thank you and well done. I will ask Dr. Waqas Ahmed, please start his presentation.
Thank you. Let me just turn the video on. And first of all, thank you so much, and great work, Dr. Chugtai. And I always say you are one of the pioneers who led this initiative in Pakistan. So hats off to you.
Thank you so much, and I'm very grateful to Dr. Shakil Puri and Dr. Suhail Chugtai. This was not a planned talk, and I just gave in a message that I want to give my feedback. We live in a poor country, and all of us know that in order to create this EMR system and to establish it, we need funds. We are very grateful to Dr. Suhail Chugtai, who actually first came in 2019 and gave this idea of telemedicine to us Pakistani physicians. And in January, when he sowed the seed of this idea into the minds of the stakeholders of the government, it was in March when we had the first upsurge of COVID patients. And I work at King Edward Medical University as chairperson of Department of Medicine, which is affiliated with Mayo Hospital. And many of you are from King Edward Medical University. The capacity of 415 patients was crossed at that time, and it reached up to 423. That was the time when there was a meeting called by the governor of Punjab, and all the vice chancellors were instructed to create telemedicine department. And I must appreciate Dr. Suhail Chugtai for having sowed that seed and having talked to he did not put the pictures of our university in his presentation, but we had a wonderful presentation with him as well. And our worthy vice chancellor, I must salute him for establishing telemedicine department within 10 hours. Can you imagine? This was instructed at 2:30 p.m. and the next day, 8 a.m., we were all ready. The reason was we had an established e-library, which was converted into telemedicine department. And it was started the very next day. And there was no funding done by the government, number one. And all the calls were absolutely free of charge, number two. And number three, all the calls were attended by senior registrars, assistant professors, and even professors in the beginning. So these were three things which our university, I think our vice chancellor should be appreciated for this, that he encouraged this and he instituted this. And one step I would tell you, we were instructed to make a tele-corona desk and at least 4 desks. But his vision was beyond corona. We established tele-OPD, which included medicine, pediatrics, surgery, gynecology, pulmonology, ENT, orthopedics, cardiology, and last but not the least, telepsychiatry. And all of you know how it affected patients as well as healthcare workers all around the world psychologically. So this is how, and recently we also added telenutrition, because many patients would be asking about nutrition. We got about 15,000 calls per week initially when the corona surge was very high. So this was definitely not an EMR system. It was basically based on Skype calls. I know Dr. Chugtai insisted that it should have been a proper EMR, but obviously we had to look at funds, and we had to look at the finances as well as the feasibility. So it was not an EMR system, but believe you me, it was so helpful that at that time the outdoors of all the medical public sector hospitals were closed, including Mayo Hospital, which used to receive about more than 1,000 patients per day. And when that 1,000 patient had to seek advice, it was through Skype, it was through WhatsApp, it was through those who could not approach through either one of these, either video calls, they were given landline as well. And all of these numbers and these IDs are present on our King Edward Medical University website and are still in use. This service was offered 24 hours. And I must say that it was the initiative of Dr. Suhail Chugtai, and it was the effort of Professor Khalid Masood Gundal that we were able to serve. And I feel proud in saying that we received calls not only from Lahore, Punjab, but from all over Pakistan, and very interestingly, from UK, from USA, from Belgium, from Denmark, from many calls from Middle East. The reason was that they were Pakistani patients. They wanted to speak in Urdu, and they could not afford to pay for telemedicine offered in those countries. So it was, I have those, our IT department has that, those statistics, and we have actually even done a research on them. And there have been research articles on telepsychiatry services offered as well. So this is what I wanted to share. And one more thing is, thank you, Dr. Chugtai. You talked about Mustafa Kamal Pasha. Every difficulty brings about, brings opportunities. And this difficulty and this challenge of COVID, it made us cry, it made us lose people. It made us learn a lot, and Mustafa Kamal Pasha was my first cousin. So I'm really thankful to you. You paid tribute to him. Thank you so much. I know I was not within the program, but I'm really grateful for having given this opportunity.
So I've got some questions here. First one is from Masuma Aslam. She's saying that it would be a great favor if you send me the list of diagnostic equipments attached directly with the computers for telemedicine practice in a setup. I think Dr. Chugtai might be able to answer that.
Yeah, I think I'd love to take this question if I may. I want to actually, first of all, thank Professor Bilkis Shabir. And she has been very complimentary. And I believe that Professor Dr. Khalid Masood Gondal was very inspirational figure. He is, and he actually took the initiative head on. I'm sharing a picture of King Edward Medical College seminar. I was given the opportunity to instruct from here in London, and he was very instrumental in setting this up. The picture was not of good quality, so I couldn't share that. But I respect what KE has done, and I have a great regard for your effort as well. Answering this question, can I share my camera? I want to show you this device. Can you see that? That's a camera which can be done for teledentistry. Okay. So this is one device which I connect to my software. Then I want to show you some other devices. That's an ECG device, a portable ECG. See that? You put your fingers there, and then your single limb lead 2 ECG will be conveyed on the screen, which you can export to a doctor away from you through a telemedicine app. Then there are many more. So this is again a portable ECG. That means if I put my finger there, my pulse oximeter reading will be here, my oxygen saturation will come on the screen, and then this will be connected to my phone through a Bluetooth, and the Bluetooth will convey into the EMR of the telemedicine, so the doctor can see it, whether he's sitting live with you or you're doing it as a patient away before your appointment. And there are more. If I keep putting my head into my drawer, I'm sure I'll find a lot of things. I live in my telemedicine lab, and as you can see that I'm not showing you the pillows and everything, but let me show you something else which is more interesting. Yeah, okay. Now this is iHealth device, glucometer. Now You can see that this can be connected to a mobile phone, and the moment you have your blood drop rolling on the strip, it will be conveyed through the database using your phone Bluetooth, and that database is shared by the telemedicine. All you have to do is to allow your own software to do that. And I can just quickly perhaps show you on my screen this very quickly, how this is done quickly. Here it is. Can you see that software? By the way, these are the softwares this is that doctor's telemedicine helpline. And then you have Sehat Ghar now. This is our project for Punjab, 65 million people living in rural areas. We're connecting them. They're in different cities of Pakistan. This is a project for private practice, Citrus Telemedicine, where you have specialists in different categories. Now, all of these devices are available on these software. This is another ICU project for Pakistan. This is a video room project. That is for America. This is again a Sehat Kahani project of mine, software I use. This is telemedicine software by a pharmaceutical company. This is all in Pakistan. We are giving it to country. So all you need is just make sure that the device you're using has an API. If the device has an API, that can go into a telemedicine software. And that is all you need to make sure. There are many blood pressure devices, ECG devices. I can keep showing you, but I really want to give other people to answer this question as well. Thank you.
The next question is very interesting. It's from Babar Shiraz. He's asking, do you cover smaller districts in Punjab, and what services are there?
Can I take this one?
Thank you.
Yes, we do. I want to actually show, rather than answer the question. This project, which we have started at this project is not a project. It's a proof that we have won the confidence of the government. Government was very shaky in January. Telemedicine, okay, we'll call you back. But then this project has been asked to be installed. So that 6-month shift of paradigm, what does that tell? That a good example, a deployable example of telemedicine software can win the confidence. Just giving a concept doesn't win the concept. Go and do it. And that's what we did. We did the telemedicine helpline. The government said, can you extend this project beyond Corona? So this is now a project where we have connected. You can see on the left-hand side, Punjab has 9 divisions. Bahawalpur, Deza Ghazi Khan, Faisalabad, Gujranwala, Lahore, Multan, Rawalpindi, Sahiwal, and Sargodha. We have started with Lahore. This covers 65 million people in the rural of Punjab. We want to connect the basic health unit with the THQ, Tehsil headquarter, and the DHQ, district headquarter. And the idea is that woman who brings a child in basic health unit and the doctor tells, isko specialist ke paas, bachon ke doctor ke paas le jao. Go and take this child to the child specialist. Now that woman has got an ill, crying child. She has to get on the bus and take it to a specialist. And that is so painful. I want to bypass that. I want to bring a specialist in that BHU. In fact, we did that in trial consultations. And we, in fact, in one example, I saw the tears in the eyes of that patient. क्या मुझे यहाँ डॉक्टर मिल जाएगा? बड़ा डॉक्टर जिसे कहते हैं, यहाँ मिल जाएगा? Imagine the relief. You can get that vada doctor back in the village. This is telemedicine. Let's forget everything else. Let's look at the patient, what the patient needs. If telemedicine is around consumer, the patient, they will want it. It's not a product that we put on the face of the patient. Go and use it. We have to make it practical for them. Now, this example, we've started with Lahore. If you go to Lahore, you can see that we've got 570 doctors trained in Lahore only. And about 37, how many tehsils? Let's go into tehsils. Let's go into Lahore. And then I can show you how many. Yeah, Lahore Kent, Lahore City, Model Town, Rawalpindi, they're all covered. Let's go to Lahore Kent. You can see that all these doctors are actually operating right now and giving service to patients who are in small BHUs. So the other problem was, as Dr. Vikas rightly said, the bandwidth is one of the issues. So I went back to my lab and segregated the bandwidth like Netflix. I have used the power of the processor, not the bandwidth heavy. I decode my signal and recode it back when the signal reaches there. And then we put a node in Pakistan, which makes the handshake easy. So the latency is one half a second or less than a second. Now that allows a village to have an HD telemedicine like Netflix. So we have actually, mashallah, got it. We have won this technology, and I'm sure that the whole country is open now for us to make sure that we provide healthcare. This is my vision and my dream, have a virtual NHS-like system in Pakistan. APPS UK is actually determined to do that. And I will be helping my own organization here to get my doctors there back in Pakistan. Thank you.
I'm just going to take, there are two questions. I'm going to combine them. Ijaz Iqbal is asking how to get admission for masters in the telemedicine. And will that be an online degree? And another question is regarding medical insurance. Muhammad Adil Akhtar is asking, what are the medical insurance requirements to offer services in Pakistan while you are a doctor based in UK?
May I take this, as I'm perhaps directly related to this? Master's degree in telemedicine that has 8 modules. You have to do 6 modules in 3 years' time, and each module is about 16 weeks. The learning objectives of each module are being designed at the moment. We have finished with telehealth, and we are starting that in December. To take an admission, you have to contact the University of Health Sciences, and there is a medical education department there, which has complete control of all the application forms. There is an online application available as well. Dr. Saqib Mahmood will be in a position to guide you more at the University of Health Sciences. The second question was regarding, what was that? Sorry?
The medical malpractice.
Medical malpractice insurance. If you are prescribing from UK, or if Dr. Vikas is prescribing from America, as long as that prescription is dispensed by a local GP as a second opinion from an American or British doctor, you are legitimate. Or if the doctor from abroad is PMDC certified, he doesn't require a second opinion guy in Pakistan. Thank you.
Thank you very much, Shaista, for helping out. And I will ask Mr. President to say a few words. And Mr. Puri.
Thank you very much, Apps UK team, for another very useful and a unique topic today. I can see, and I'm just talking to the viewers and the young doctors, that now you can help people beyond boundaries, and the examples and the results and testimonials are from the highest authorities you can see. I feel very proud that Dr. Sahil Chugtai and Dr. Vikas, you've done so much work, and you have created something very unique for the medical professionals. Now, I'm very thankful for Apps UK team who's conducted this, Dr. Irfan Rashid, Dr. Abdul Hafiz, always coming out with these lovely ideas. Dr. Shaista, thank you very much for conducting the Q&A so well. Thank you very much once again, all of you. Until the next time, goodbye from us, and look out for our next symposium. Thank you.